Hey, there's Mary Lou.
Well, good evening, everyone, and welcome to this, our second installment of our local conversation with medical professionals here in Willow Grove, and basically just with our friends, but friends who work in a number of different settings and have a lot of wisdom together as we come together, but also have access to finding out answers to questions that perhaps we don't know the answers to yet. This came about just because, as we looked at where we've been and where we're going, the last time we gathered specifically to talk about this, it was early August. We were nowhere near where we are now. We knew quite a lot about the process of what it takes to produce a vaccine, and we talked a lot about that, how scientists work to test the vaccine, to think about efficacy, and also just a little bit around other related issues. But here we are now with the vaccine having rolled out specifically even in our local area since mid-December with health professionals, and much more publicly on January the 6th with county and other type distribution. Here in Montgomery County, we actually have about 110,000 people that have received at least a partial vaccine. About 30 to 40,000 of those are actually full vaccinated persons. But amongst the adult population, that's about 16% of our adult population that has been vaccinated. Of course, one of the big frustrations right now is distribution, and there are still a lot of things in development and that are happening, but we just wanted to get together here and be able to pick each other's brains and share with one another. So this is a very informal structure, and we're just going to let it be open to where it leads. And I'll just open it up to start with Abby and Ed and ask them if they have any particular opening comments they would like to make.
Go ahead, Ed.
Oh, okay. Well, it's still an ongoing situation, and we are getting better. The statistics I just pulled up just recently, and actually just recently, 15% of the population have at least one shot. The big thing we always hear is herd immunity. Well, herd immunity would be about 70 to 90% of the people getting vaccines before we could more or less say, we'd still like you to keep socially distanced, but restaurants can open up, go back to the beach, feel free about walking around. And that is all depending upon how quickly we can get the shots done. Right now, I think they're estimating we're doing about, about 1.5 million shots a day throughout the United States, which is, when you look at that number, it's truly a remarkable number. But to get herd immunity by May or July, we would have to bump that up to about 3 million a day. So right now, with the numbers being what they are, we're not going to reach that mark until, say, about November. Now, with supplies, well, in the manufacturing of vaccines, it's not where I can hit the button and make the tablet machine go faster, or bring on an extra shift and have that extra shift run. Because of the way these things are made, we have a lag time. And the reason I mentioned lag time is we just heard we got J&J approved. J&J's one-shot dose is more of the typical vaccine compared to the ones that had already hit the market. So when they start distributing them, and they have a lot of vials to distribute, we're going to see a major increase in the numbers. People are going to be able to get their vaccines. We're going to have a lot of people covered. And then all of a sudden, you're going to hear in the press, they're restricting everybody again. what's going to happen is that J&J gambled with their vaccine, knowing that they looked pretty good and would probably get approval, and made a certain amount. They didn't gamble totally that they would get all the approvals. So they're still manufacturing, but there's going to be that lag time after all those initial ones go. Biggest rule of thumb, though, if you can get the vaccine, get the vaccine. Am I okay with the ones I'm getting and everything? Absolutely. The protection numbers are really looking nice. And the thing is that we have enough time now that we've had like those aftermarket researching things where maybe, just maybe, and I'm sure we've seen this in the press, maybe we don't need those 2 shots of Moderna or the 2 shots of the Pfizer, because that 1 shot might be what we need to do. We still recommend getting that second one because we don't know for sure, but the numbers are looking better and better and better and better. In fact, to tell you the truth, my impression, compared to what the average flu shot is, the effectiveness of these shots are just
It's amazing.
fantastic.
It's unbelievable.
It is. So definitely worth getting. We're getting better. I love looking at graphs going down. We're seeing schools that are taking that opportunity and opening up. Are we going to see life as we knew normal? Well, let's use that as a new normal. We are going to see some of those things that have been done in other cultures for quite a while. You're not feeling too good today, you're going to wear a mask. Okay, so we're getting there. We're really, really getting there. And those that have seen me on the church videos, yes, there are a couple little side effects which are kind of fun. But to tell you the truth, very, very limited as opposed to getting COVID. For those that saw me a couple weeks ago with the hood on up and the blanket and everything else, by later on that afternoon, I was back to about 80%. And by the next morning, I was ready to get things done around the house and everything. So to tell you the truth, if I got to go through a couple hours of a sore arm or a little bit of chills, sure beats COVID.
Yeah.
Sure beats it.
The one thing I want to add, Ed, and I think this is important for everybody to know, that getting the vaccination won't necessarily prevent you from getting COVID.
Right.
You're
not
still susceptible to COVID, but you might have more it might feel like a little bit of a mild cold.
Mhm.
So you just need to understand that. So even if you're vaccinated, you need to socially distance and be careful around folks that have not been vaccinated, because you have a hyperimmune system now and they don't. So they remain vulnerable regardless of their age.
That's
It's
also
just-
why we need to continue wearing the masks. Okay,
Yes.
if I'm fully vaccinated, I might pick up COVID and feel like, okay, I got a little bit of sniffle, I had a little bit of a cold, but I can transmit it.
Right,
If
to give
I
it to
have that,
someone
I'm
else.
still able to throw out a good sneeze or a good cough and infect a room if I really needed to, if I don't want to do. So even though you're vaccinated, all those things still hold true. Social distancing, washing, using that mask.
Wear your mask. A couple things about the vaccine. One of the big questions is, which one to get. Well, the answer, kind of tongue in cheek, is whichever one is available to you. Okay. And a couple things to think about. Some of the screening questions that you'll be asked. If you've ever had any kind of an allergic reaction to flu shots or the shingle shots, they're going to ask you about that. And there have been times when you might have had a marginal reaction, maybe within an hour or two of getting that medication. So they would have you take Benadryl and Tylenol and something before getting the next vaccine. In this circumstance, you don't want to do that. Okay, you want to get your dosages of this vaccine without that medication. You want to stay hydrated. You want to use your arm. Now, people after getting the vaccine sometimes have the chills, headache, muscle aches, joint pain. If it's really not tolerable, they say then after the injection, you can take Tylenol. I would say try to tough it out if you can, because what you want really is your immune system. The first dose sets the table and the second one reinforces that response. So if you feel a little off, that just means that your immune system is responding, and that's a good thing. The arm pain or the arm tenderness, use it. Use that arm. You can put cool compresses on if you need to. Sometimes people will get a little itching there. They're actually calling it COVID arm. There have been some people that have actually gotten some lymph nodes in your armpits and up into your neck. Again, not an unexpected side effect, but it could happen. So women or anybody who needs to have mammography, you would schedule your mammogram at least 4 weeks after your last dose. Okay, and Debbie, they can develop like a lymphedema kind of a thing.
That's true. Yes.
So that's the reason there. Those are just some findings that we've experienced ourselves personally and then have been reported in the literature. So Craig, you're muted.
I'm sorry for interrupting. I have a question. Let me get it out before I forget. The pastor used a big word to me, efficacy. Can somebody explain that to me? Does that mean effect?
Yes.
Yes.
In the short
How
version?
effective is it? And usually they equate that to a certain percentage. Like CDC is really excited when the flu vaccine is 30% efficient or effective. Well, we're talking 95 and 96% with Moderna and Pfizer.
I'm sorry, what was the flu?
30 on a good year.
Really?
Right. And that's because there are so many variants. And remember,
Right.
that's part of why we're trying to control COVID now. The more widespread COVID is, the more variants that there are. So you'll hear things about the South Africa variant, the UK variant now. There's a New York variant. We need to stop the disease spreading as violently as it is, because then it doesn't mutate and adapt to the environment. So but the efficacy is high. Again, Abby's right. That's why the flu vaccine, there's a new one all the time. They keep modifying it, and it's maybe 30 to 40%. I think even J&J is 85% effective.
Yeah, it's a little less.
But no one in the test studies with J&J, no one at all died.
And very few hospitalized.
And very few hospitalized. But for so all three of them are really good. And I agree with everything that's been said, that whatever is available to you, just take it.
Can I just
You're really not going to have a choice, is what you're saying.
No, you're not.
No, you're not. You're not. So literally, when you get that email to say, hey, we can schedule your appointment, like
do it.
Even in healthcare, and I work in home care in our agency, and it was literally changing hour by hour. And it was like a tsunami. We got word that Chester County was scheduling. We all literally stopped what we were doing and jumped on the site to try and schedule. So when you're aware that, you know, you're getting close, I would be checking your emails all day long. Because
Can I just add one other question, or perhaps it's an observation? So you're right, Craig, that was a big word, efficacy. But I also thought yeah, it's a word that I've learned. It's kind of like asynchronous. A lot of you might not need to know the word asynchronous or synchronous.
That's a COVID
By
term
that in
now.
education, but it's like the world I live in with the kids. I also think they talk about efficacy and efficiency. And actually, I believe that in listening very carefully to Dr. Val Arkush, who is one of our 3 commissioners, and by which we are significantly blessed to have a medical doctor as one of our 3 commissioners, I believe those are actually different. And if I'm getting the actual terms wrong, I apologize, because I'm still learning myself. But the point is that there are 2 different terms that are used, and one of them is about the testing that happens in vaccine production and the controlled groups that happens. So there's the actual population that has been tested, in many ways is not going to be a full representation of all of the contextual variables that are in a community or across an entire nation. So I think efficacy is sometimes used to talk about the vaccine testing stage, and effectiveness is used to talk about now that it's out in the world, now that millions and millions of people are getting it, it might react a bit different. But that's what Ed is saying, is that even though it seems a little bit early and it's really only 3 months, we are starting to get a much greater level of significant data as it's now been rolled out fully across the United States. So, and it is just important, the work that scientists and the feedback loop that's happening right now and the analyzation of that data, in order to continue to make modifications, and, you know, to look towards the future as well. I mean, right now they're already starting to think about productions of variant related, the inclusion of variant related things actually right into the vaccines as they're, you know, trying to work on rolling them out. Okay, so
Lorelei, just to put it in one sentence, efficacy is, and there my phone goes off, efficacy is something is how well it works to bring the results you hope for or it was designed for. So it's the process, and then what is the effect on the population of people getting vaccinated. It's also the end result.
Yep. Does that help, Craig? Okay. What other questions?
When are we going to see AstraZeneca?
Probably, I heard several months down the line on AstraZeneca.
Yeah, they're a little.
There are 2 that
Craig had
are
his heat
still.
up. Craig?
Go ahead, Ed.
There's the AstraZeneca and another one from a company, I think it's called Avena.
Honey, I don't know what's wrong with
they
your
have
transmitting,
one-
but it's not good.
I'm not coming through good?
That was better.
That's better.
Okay. So the 2, AstraZeneca is one of them that have gone back to the drawing board a little bit. They weren't seeing the results that they truly were hoping for. And some of the companies, I mean, remember way back when we did the first one, I think I had a list of about 20 some odd companies that were doing research. A lot of these companies have done 2 things. Number one, they've either dropped the research they were doing and have started looking at the variants, or they have actually started negotiation with companies like Pfizer and Moderna, sitting there saying, no, we have the facilities to at least package these and get them going. Our research didn't really pan out, but if you'll share with us, we'll make yours and ship it. That goes into a lot of business end of it. I mean, I don't think, Coca-Cola would turn around and accept Pepsi, saying, I got this empty plant here. How about you guys come and make your Coca-Cola in my plant? Now, you don't have to send anybody, just give me the recipe. So we have the 3 companies, and I really don't see much other coming out onto the market.
Can I
Greg,
do
what
it?
was your question?
I'd like to do part 2.
Okay.
Here at the Weller household, we are very reluctant to move forward with the shots, whatever. Linda sees this or that on the internet and says, "Oh, it's dangerous. I can't do that." Or what's the other one? Thalidomide?
Thalidomide?
Thalidomide.
Oh my goodness.
They don't
Oh,
even use that
Craig,
anymore.
No.
that was
That
from 50 years ago.
I understand that, but we could have a modern version.
That's
That
the
we're
fear.
not. Millions of people have gotten the vaccine, and we're not
And how
having.
long did it take for that to become a problem?
And that's a drug. It's not a vaccine. It's the vaccine teaches your body to respond to a virus. A drug is different.
Okay. All right. So I'm being yelled at here politely, but I'm being yelled at.
No.
No, it's okay. I
That's a real
understand.
good question. People, we have to be able to.
I mean, what's the refusal rate? 33% or something?
Yeah, about.
Yep.
I
So there's
mean,
a lot of fear out there, and unfortunately,
we are
there's a
out
lot of
there.
myths.
We are out there, and if you would just kind of, I don't know, somebody speak to that for a minute. I don't know.
Okay.
There are healthcare providers that are very much concerned and worried about getting the vaccine. You're in good company. It's not like, like you say, Linda's researching and looking into things. There are healthcare workers in the hospital, nurses, respiratory techs, and other healthcare staff that are very concerned and have put off getting the vaccine when it's been offered to them. So it is important to think it through and think about it and maybe play a wait and see.
Should I do anything different, staying in my home longer or whatever?
I don't think there's anything different you can do that science is telling us would be safer.
Mask, distance,
Yeah.
wash hands.
Yep,
Same
wear a
old.
mask. Double mask is the only thing that's really changed. You could wear a double mask, they're saying.
Right.
But
The biggest thing with a vaccine compared to a drug, okay? What I used to tell my students, okay, when I'm introducing a medication into a body, a drug, I'm looking to change something and modify it to get an end result. The other thing you're taught is that the side effect of the drug is the extension of it. So if I give you a medication to get rid of extra fluid in your body because I want to control your blood pressure, I can come up with that medication and make that happen. If I go too far, I've taken out too much fluid out of your body.
You've got 7 side effects.
And I got everything going on. Now, with a vaccine, I'm not really looking to do anything more than your body already did.
Right.
I mean, one of the ways we could do this is get a nice little aerosol truck, drive around everybody's neighborhood and flooding it with a mist of COVID. And we're going to get people who are going to be coughing, sneezing, gagging, choking. And a few weeks later are going to feel, okay, I got through that cold. And we're also going to kill about 500,000 of them. We didn't have to do the injection. We could have did it this way. It's kind of a cruel way of doing it. So if I can make you feel a little uncomfortable for a few hours,
It's
and
still
get your body
tolerable.
onto that, it's worth the shot. Okay. that's where this like herd immunity, what ends up with herd immunity is that we have this large number of people that are already protected. So you could wait till herd immunity, not get the shot. And what's going to happen is that all of a sudden these people around you are all protected because they got the shot. The virus is still there. You may still have that chance of getting the virus. Take that roll of the dice. Along with the fact, if you're healthy enough, you may get what you thought was a cold, but it was COVID.
Right.
So now you have that protection also. So not getting the vaccine, you have a risk that you're voluntarily taking.
Yep.
The thing when it steps into public health is when the steps that you're taking affect so many other people. That's where we're seeing colleges where, we were seeing outbreaks of measles and mumps and, things that we thought we got rid of ages ago.
Right.
Where great
Because
now,
of lack of vaccination, lack of vaccination.
lack of vaccination, lack of update. So what happened was, it's great. We had a lot of uncomfortable people for a period of time, but all those people are now protected. They built up that immunity because they survived it and did whatever. So we solved that problem. But we didn't even have to go through that problem if we all would have been up to date.
Right.
So things are going to be out there forever. I mean,
Yeah, this
we're
isn't
going to
going to go away.
things popping up there forever. The object is how do we approach them?
Right.
Ideally, we'd love everybody to get the vaccine. Not everybody's going to get the vaccine. Is it going to cause a major health issue? No. I mean, it's going to be noticeable, and we'll be talking about COVID for a long, long, long time. But, it's a decision that has to be made on the protection of.
And I have a really dumb question.
No dumb question.
Never done.
No dumb.
Why did this happen now and not 40 years ago? Why didn't Spanish flu come back?
Tell you the truth, when you first heard about COVID,
We've had COVID-like viruses, the SARS, for instance, of which this is a
that's what
offspring.
The swine flu.
We had SARS viruses
Swine flu.
pop up a few years ago in the press and everything else. This is just another one of the SARS viruses. It's just a mutation. And as we see in the press, how quickly these things mutate.
Yeah, they're
It doesn't
very
really
smart.
take all that long.
And this is pretty deadly.
Okay, wait a second. Mutate. So mutate is a change. So it can change for the better or the worse, correct?
Absolutely.
Usually for
Absolutely.
Most likely
Yeah.
for the worst.
Real.
thing is,
Well, that's what we're
we don't
worried
go
about,
looking-
obviously.
We don't go looking for the better. We only see the worse. So
Kind of like
there might be a
selective.
variant of COVID that isn't really causing much more than you having a sniffle for a day or two.
Yep.
But you're not going to go to the doctor. You're not going to get tested for it. So we don't know if it was or it wasn't. When the variant gets nasty and we have a chance of, unfortunately you're in the hospital and now I can do all these studies and look at things, that's when I notice that, oh, this guy took a change. It used to do this, now it's doing this. So I need to keep it under control as much as I possibly can. The lesser the numbers, the harder it is to turn around and change. Go ahead, Ab.
Craig, just a comment to your concern. There is a lot of fear out there. And unfortunately, the fear is driven by misinformation, lack of good sources. So when you're, sometimes Googling on your smartphone or whatever can be almost a lethal exercise if you're looking at certain websites that really they want to take advantage of you, like the .coms or whatever. You need to be looking at good resources that give you accurate research-based data
Yep, science-based.
to make the best decision possible for yourself and your loved ones. These 2 vaccines and now a third have not had any of the scientific methods taken out. These vaccines have gone through tried and true scientific methods. Now, what it has done is it has compressed the time frame. Okay, we have learned so much about this virus and how to counteract it in a year. This didn't exist 14 months ago that we were aware of it. So you need to be informed, and informed by reliable, trustworthy sources. Ask those questions. That's important. Have a conversation with people you trust. Your primary care physician. Certainly any of us privately would speak and answer questions. But I don't want anybody to feel tonight like, well, if I don't feel comfortable in getting this vaccine, then I'm a horrible person. That's not our premise here. But on the other hand, Ed and I have already gotten our vaccine doses, 2 of them. Maybe it would have been nice to wait for the Johnson & Johnson and only have 1 shot to take. That's what my son Jamie is thinking. Don't ask me, but so for people who don't like needles, that's significant.
Can I ask another question?
Yes, but I don't want.
How many people vaccinated so far?
What, up to Debbie?
No. I mean millions.
Oh,
16? 16? Are we up to 16?
55 million shots have been given, but a 2-dose, you're around 25,000.
Okay.
Left are fully vaccinated.
So out of those 25 million, say, have there been any at all bad outcomes?
Well, what do you just,
whatever.
You mean
I want
like
to know what the
death,
definition of bad outcome is, though. What is
anaphylaxis and you die?
Yeah. So has there been, Abby? Not that I know of.
Not that I'm aware of.
Nope.
Conceivably, it could if someone has never had an allergic reaction that we could pick up on a screening survey. That's why when you get this vaccine, first dose, second dose, or 1 and only, you must wait at the site 15 minutes minimum. 30 is better.
And they're making you do that to see the outcome, if you will.
Correct. Correct. Because if you feel what I did when we were giving vaccinations down at Dover DMV, I said, if you feel anything different than you do right now, this second, you're going to flag. And there were patrolling paramedics in the parking lot area. We directed them to a certain area, and that's where they were to stay for at least 15 minutes. Now, having said that, there were some people who continued to drive off.
Yeah.
Okay, but that's at your own risk, right?
Yeah, the clinic that I did this past week, we were given, basically, we held you hostage. Because we took your vaccination card.
Interesting word.
When you gave you the second shot, and you had to go to a waiting room and wait 15 minutes. And then you had to go back out to the desk, and the nursing student would give you the card. So the nursing student was keeping track, saying, you got this card back to us at 10:15, and it's not 10:30 yet. So go back there and have another donut, or But it was really just to make sure that everybody was doing okay.
Wait a
And we were
minute, I
doing
get
a lot
donuts?
of elderly population. We did it this one, which was, to tell you the truth, it was a total shock because they delivered a whole bunch of donuts, but no coffee. Yeah.
Yeah.
So,
I got my vaccine in Chester County at the health department, and it was something similar where the first vaccine, I mean, you went through the whole process, and as soon as you got the vaccine, the nurse said, please take out your phone and set the timer for 15 minutes. But then you went to the next room and you sat, and there was an EMT there. And, but when I went for my second vaccination, they said, did you have any reaction at all to the first one? Any adverse reaction? And you got a different color armband if you had reactions. And so anyone that had any type of a reaction at all after the first one needed to check in with the EMT as soon as they had their second vaccination. And they were required to stay for at least 30 minutes.
30 minutes. Yeah.
But Craig, to get back to your original question, I think early on when the Pfizer vaccine came out, there were maybe 2 or 3 different people in phase 1A that did have adverse reactions and needed emergency care. But
They're now fine.
But now they're fine, correct. So they did have a reaction, a sensitivity to it, and did go to the ER as prevention, but it was nothing really worse than being cautious.
And I think based on what you are both saying, so can I clarify 2 things? One is that it sounds that not only like Abby and Ed have actually received the vaccines, but they've now also participated in the administration of vaccines. Is that correct? Yes. Okay. So that's the one thing. And the second thing was, and that the most common reaction that there is expected to this vaccine and is very common amongst many other vaccines is an allergic type reaction. Is that, and the allergic type reaction?
It's not an allergic reaction.
No.
It's just a response to the vaccine. Your immune system starts becoming active. So it's not an allergic. That's why I was asking Craig, what did he think was the bad reaction? The soreness, the aches, the chills, feeling yuck the next day, that's all a normal effect of a vaccine. Chickenpox vaccine, meningitis vaccine, TB vaccine.
Yeah,
Shingles
interestingly,
vaccine.
Emma turned 11 this past year, and she just had her well visit. And Emma was a little nervous about that because 11 is a huge year in the vaccine world. She had 3 vaccines.
Yep.
And she did have a little bit of a reaction. Her arm stayed warm for the best part of 2 weeks.
You can have 2 different types. There's the general overall your body and difficulty breathing, things starting to swell all over your body and your airway. Okay, so that is definitely a medical emergency, and that's why you would have or expect to have emergency equipment and qualified people to administer it for that type of a reaction. And that typically will happen within like very, very shortly after receiving the medication. The other one is a local reaction, allergic reaction. That's why they call it COVID arm. You can get, I got a wheal about this big around where the injection site was. It was warm, it was itchy, and it was red. It started probably about 3 days after I got the dose, and it was gone the next day. So if I need to do this again, I would report that. Yeah. Okay. As we move down this journey against COVID, those body reactions need to be communicated to the healthcare professionals. They will then be able to take in that information and help guide you to what's safe and prudent care.
Now, this isn't just really, from COVID or the COVID vaccine. I've had a chance of doing the shingle shot, the Shinglix, the new one that's on the market.
Same deal.
That's a 2-shot deal. You get the one and then you come back a few months later and we give you the second one. We see the same type of reaction with the shingle shot that we're seeing with the COVID shot. So when I see these reactions with the COVID shot, especially the second COVID shot, I'm already in my mind. I've seen this before. I saw it with the shingle shot and the people I was giving the shingle shot to. It was the same situation. The first one is giving your body that, you know, as Abby said, set the table. And that second one is driving the fact home. So we were seeing the same type of reporting with people getting their second shingle shot, saying, you know, yeah, oh man, for the day I felt a little, my arm was like, you know, and that was all great. You know, I mean, from a medical standpoint, you sit there saying, that's great. You know, it's like, well, yeah, but I felt like.
Right, that means your body's doing
like,
what it
okay,
needs
well,
to do.
Your body's doing what it needs to do. You felt home for a day. Could you imagine feeling home for a couple weeks? You know, take the day, save the weeks.
I think at one point Kim Swalje had a question. I don't
Well,
know if she's
Kathy's
hanging in with it
first.
or not.
Yeah.
Kathy's first. She's been waiting
Oh.
patiently.
No, well, you already answered a couple of the things I was going to say.
Oh, okay.
But no, I just wanted to say that, I mean, 3 people in my household, we've had our first Moderna shot at Norristown High School.
Okay.
And it all runs very smoothly. It's very well run. And yes, they make sure you sit there for at least 15 minutes afterwards. And so while you're sitting there on the bleachers, waiting for your 15 minutes, there's a woman that comes along and, you know, you get, as soon as you get your vaccine, they give you a little card that tells you the date, what the vaccine was, your name, and the date of your next one. And then this woman came around while we're sitting at the bleachers, and if you had a phone, you could take a picture of, she had showed the, it's the CDC website, basically, with one of those, what do you call those little square things that you can?
The barcode for the
It's like a barcode. the
QR
little
code.
scanner.
scanner.
It's a QR code.
Thank you.
Okay. That little thing you can scan. So you're sitting there and you can take a picture of, she's holding this little card, and you can take a picture of this little thing. It immediately signs you into the CDC website.
Right.
And then they check in with you every day for a while to make sure you're feeling okay.
You're doing
or to
okay.
see if you're having any problems. So I'm telling you, they follow up really well.
And just to add to that, Kathy, Craig, the CDC is a reputable site, the Center for Disease Control, where you want to go and look up any illness, any virus, any condition, and you will get reputable scientific information on it.
Right. And it's a site that's pretty easy or easier to navigate through.
Yep.
Mayo Clinic has another really good site, Kaiser Permanente. There's a wealth of information out there, but you need to be really discriminatory about what you follow. You want to make sure that they've done their research effectively.
How about Kim?
Yeah, I know that right now people 16 and up can have the vaccine. So Casey will be eligible when her turn comes, but Tegan's 14. Are they doing testing yet for
They're
kids?
doing research now.
Okay.
There's a couple studies going on right now. I think the one I saw was all the way down to age 8. Now, it's being done in England, who really got a little bit of a head start on the whole vaccination process. I mean, you know, they kicked in, you know, I think almost a month before the United States was able to get everything rocking and rolling. So with the numbers that they already have, they've been able to get enough volunteers of younger age and say, let's give this a shot and see what happens. And things are looking pretty good. It doesn't, I mean, it's still well too soon to say. But so far, things are looking like, yeah, we can do this. And the two that I took away from the study is the fact that their side effect profile or their reaction to the shot compared to us older folks was far, far better. It was sort of like when they were filling out the questionnaires, did you have the chills? Did you have this? It was like, no, 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 which was really interesting. But also the numbers that they've looked at of children in households where parents have been vaccinated or parents have not been vaccinated. And they're finding like these kids seem to tolerate this a bit better than a lot of us. So that's getting us a little time to concentrate on that more important, I don't want to say important, but the more at-risk people, and then trickle on down to where's going on. It will probably be into the middle of the summer before they start, saying, okay, let's drop that age from 16 down to 14, down to 12, down to, whatever it may be.
I believe, Kim, I read before we came on that Moderna and Pfizer are both doing lower ages, minors down to 12. And you're right, I did read something about 8-year-olds and up, Ed. I think for me, what I see though is that they originally thought children don't get it. And now what they're finding is children do get it, but have fewer symptoms. So they are becoming the passer around or the super spreaders. And that children are feeling more of the social and emotional and the separation of this virus and this pandemic, more so than adults. And so it's really important in terms of getting our kids back to a normal routine, getting them back to school, getting them back in some structure, helping them with what we all know as parents that recently had children or maybe had them 20 years ago, that social and emotional development is so important during this school years. I'll say all the school years, that it's really affecting children. And the one study that I read were teens and minors of parents that work in the healthcare industry were the kind of first group of minors that were saying, no, I'll sign up to get that. My mom and dad worked terribly hard. This has been horrible on them. I saw them get the vaccine and they're doing fine. No, I understand. I'll sign up. And there's a very rigorous process to go through. The parent has to approve, and then the child has to kind of understand what they're going for. But it's looking good, as Ed said. And I think some of the process was also determining if they need as much vaccine as adults do, was the other piece.
Yeah,
For
the
efficacy.
large majority of them, well, I mean, the study's still early, but the large majority of them were the reports after the first shot. And, that does have a lot of people scratching their heads saying, you know what, we might not have to put these kids through a second shot because things are looking really good. So I thank all those kids for stepping up to there because, it's studies in children are very, very hard to do. It's like, you really just don't get a lot of children stepping up there to, take on a study like this.
Lorelei has a question.
So I actually have an additional question for Sue. I didn't particularly share this with the larger group, but this morning in worship as a prayer, but it's in many ways prompted by the prayer request that Sue actually brought up earlier. We have made the decision as a family that our children will be going back to school this week because the virus is suppressed down to a 5-degree percentage and just below that here in Springfield Township and Montgomery County. And that's been a huge decision for us. Seeing that the virus was suppressed to a certain degree was very important for us. Also knowing that the stabilization of the patterns in which educators had to adapt themselves to new circumstances of teaching both virtually and in person and some at the same time. And, you know, they're constantly changing pattern. We did feel, especially early on, that we had the flexibility, and I want to also add, and had the privilege to be able to keep our kids fully at home. Not everyone has that privilege, but we did. And now that we're seeing things, we're much more confident about doing that. However, I know there's an additional conversation within our district, which they're not looking to perhaps move into implementation unless certain criteria would continue to be the same until next month, but it would be looking to bring back the kids for even more school days, and therefore bringing even more kids back into the classroom. One of those particular things that does make myself a little bit nervous is that it seems as though there is a willingness to consider the reduction of the spacing between children in this new proposal for what would be the beginning of April. That won't affect what Will and Emma would be entering into for the next month, but it would affect it in April. So is there a place that you can speak to as far as significant data that is in fact saying that the reduction of space, you know, even into 3 feet is okay? I mean, I feel like that's, personally, I don't know that I feel like I've seen that data enough, but
To my understanding, there is not data at this point on it. I have seen, again, online that other school districts are doing the same thing. They're not guaranteeing 6 feet. They're thinking 3 to 4 is what they can do, especially depending on how many students come back. And I do agree with you, and I'd like to just emphasize that disadvantaged children have an increase of negative effects from this pandemic, especially with access to technology, access to parents who are able to be at home and supervise them and support them in this pandemic virtual learning. So it is important as a whole to society that we get kids back to school if we can safely. I can tell you, Lorelei, from experience that when I have a student or a family that lets me know their child was in school on Wednesday and Thursday they were sick and Friday they were diagnosed with COVID, and I backtrack and do the searching out of who they were in contact with, what teacher, you know, classroom they had. I call that teacher. I let them know, hey, can you verify for me? Was there a time when you were close together, working, you know, closer than 6 feet? Were kids congregating? And the teachers are like, no, 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 no. We're 6 feet apart and we wear our masks in this room, because the teachers are very concerned. They don't want to get it and take it home to their families, or they don't want to take it home to their older parents. So my experience at Upper Moreland is that our teachers are very rigorous about the 6 feet and the wearing of masks. They will tell me, no, Stephen had his mask, you know, down below his nose, and I asked him to pull it up and he did. I do see groups of students getting off the bus, although I've had to check with the bus drivers about kids sitting far apart, and they all do. They're every other seat and every other row, and they're very far apart. But once they get off that bus and they're walking down the hallways with their friends, they are not doing the 6 feet all on their own, but they have their masks on. And I'm not seeing that that is transmitting anything. Now, that's not good scientific data, but what I'm saying is we are not seeing kids transfer the virus in the school setting. We're not seeing it. Doesn't mean it can't happen, but I believe that what we're doing is working, and the importance of getting kids back into school for their, academic and wellness and health and development is important. And families want their children back in school. So I believe we can do this safely. I can't speak to the less than 6 feet, but I can't see that people are going out to eat and they're not just 2 or 4 people. They're bigger groups. And it doesn't appear that we're spreading it that way, or I feel like more restaurants would be shut down. There'd be some contact tracing. But I can't speak to the science of less than 6 feet.
I can speak to it a little bit from the standpoint of home health, because that's what I do.
Right.
I oversee a large part of a home health company, and my staff, and this is covering many counties, those that have had COVID have not gotten it from exposure with a patient.
Yep.
They've
Right.
gotten it at home. A family member. So personal contact with a friend or family member in an unprotected, unmasked setting. So when we are seeing folks in the home, we are wearing our PPE and we are vigilant about it. But we have not had any incidents of any clinicians in the past year getting COVID in home care, wearing your mask and all of that, and practicing the proper protocols for hand washing, etc. So I absolutely understand your concerns. I think the masks and the hand washing and the symptom surveillance are really the key things.
Yeah, I agree with you, Deb. Home care, you cannot do 6 feet away. You can't.
No.
Yep.
No, but the big piece is that in those settings, because of the boundaries that could be punishable by the loss of a job or something like that, if you were violating those kind of protocols, right? And the significant fear of the passing keeps those precautions in place in a certain kind of a way, the masking and the hand washing and so much. But what you're saying is that when we go into social settings and larger family settings, we just relax, or those small neighborhood things, that we relax and we don't hold ourselves to those same high standards. And it's when we're not holding ourselves to those same high standards that's where transmission is most understood to be happening. Is that correct?
Yes.
Yeah.
So that if your children wear their mask and their teachers are diligent in the classroom, even though it might not be quite 6 feet, I believe they're going to be safe. Like Deb said.
Yeah. Kim, you had asked about the masks after vaccination. The thing is that if we're vaccinated, we're protected, but that doesn't mean that I cannot be carrying the virus with me. So I might actually have the virus in me. My body is saying, I'm not worried about it because you're pretty well protected. But if I was to cough or sneeze or whatever it may be, I can infect a whole bunch of other people. So even getting the vaccine, we want to continue with the mask so as not to take that chance of spread.
Yep.
I'm looking on the CDC right now, and I'm not seeing anything jump right out at me on anything less than the minimum of 6 feet as distance.
Yep.
But there's also a supplemental piece to consider here. Distance and time of exposure. Okay, so the time of exposure is also a factor in this. So if the teacher in the classroom has activities where the students can be more dispersed, or their risk of exposure in close proximity is lessened, sometimes I've seen actual physical barriers, plexiglass things placed around desk cubicles. All of those things, I guess, are designed to limit exposure.
Yes, our teachers have physical barriers, plexiglass around their desks or where they lecture from. Our children all have them And the activities that are now being done in school are all individual. And if you are working as a group and your group member is 6 feet away from you over there, you just continue to work virtually and online. You don't slide your chair over and sit next to your peer. They don't do any of that anymore. It's very, they're still following all the COVID distance separation. They're following all the rules.
Does that help, Lorelei? A little bit?
Yeah, it does. And actually, I started to write another comment because I didn't want to lose it. Craig, do you think you can hold it just 1 second? So one of the things I think I hear you saying, and that I think has huge implications for us, even as we think about congregate worship, like congregational worship and stuff like that, is that one of the very quick passing comments that you made was that there are cultural practices that exist around the world that are not common here in the United States, not in the way that they are perhaps in the East. And I don't actually really know where those cultures are that you're kind of referencing or speaking to. I would totally be interested in that. But I guess what I was thinking about, one of the things that has made me cringe, and I say this truly as a pastoral leader, is that often I felt a little bit at war with medical professionals when it comes to the winter. So let me just say that again. Sometimes as a congregational pastoral leader, I have felt at war with medical professionals in the past. Now, here this is a much bigger comment. What medical professionals have been trying to teach us and warn us against, but maybe not given us the practice, is that the elderly are significantly vulnerable in the winter to things like terrible variants of the flu and other sorts of things. Mm-hmm. And so medical professionals have often said to many of our elders, you should not be in congregate settings. You should not go to church. They literally say you should not go to church. And they say that to my elders. But one of the things that I see is possibly a huge learning that we can take from this, especially once we get to the other side of these really vicious to herd immunity and these really vicious outcomes for those that are most vulnerable, is my hope that actually we will have made mask wearing a common practice.
Yep. Mm-hmm.
Because if I'm hearing you correctly, what that means is that differently our elders should be newly advised by medical professionals that yes, in fact, they can go back to congregational worship and that they can be in congregational worship because their own mental and social health is just as important as their physical health.
Yep.
And what feels compromised in the past by medical professionals is that your spiritual health is not as important as your physical health, when I truly believe they are very well in tandem. Mm-hmm. But we haven't created a common culture that by you wearing a mask, I as a young person can be carrying the flu and it could not be affecting me. And I could be washing my hands like crazy as I shake your hands and your hands and your hands and your hands. But because the symptoms are so mild for me, I might not realize that I have, in fact, infected a whole bunch of people.
Right.
But
so how we have
practices that could take us into a new place, even just by having like hand sanitizer everywhere and other things like that. So,
and how taking communion is going to be different in a COVID world. You know, things are going to be different. I think it was Ed that talked about a new normal. Mm-hmm. But the bottom line is we can manage this thing. Mm-hmm. We don't want it to manage us.
Well, and I think the other thing is, and because of how significant and vulnerable this has actually shown us that we are, that there are actually steps we can each take to protect each other's health and the health of the larger public in a way that we've put our own individual freedoms, ahead of the line a little bit. I mean, that really there's the possibility that we can be protecting each other better. And that's really a lesson we can learn in a larger cultural way.
Yes, I agree, Lorelei. I think we're changing the stigma of seeing somebody in the community with a mask and wondering, wonder if they have cancer, or wonder if they're being treated for something that's really dangerous and they can't get sick. Yeah, I agree. It will now be more commonplace to see someone wearing a mask and not think twice about it.
For 5 years from now, that'll be no big deal.
Right.
Yes.
I think in a year or two. I've seen people on airplanes for years wearing masks and thought, ooh, I wonder if they're compromised in some way. Now I'm thinking they were the smart ones.
Absolutely. Absolutely. And when you choose to get your vaccination, that little card, Kathy, you got, make sure you keep it in a safe place. Okay? Some people have laminated them,
Yep.
covered them with tape, kept them with their passports, whatever. Because that's going to be a really important document moving forward.
I did see something the other day, Abby. They're saying that an airline executive was interviewed, and he said probably eventually not in the United States from state to state, but absolutely international travel. You will need your COVID vaccine proof.
And I think even in the future, they're talking about a chip in passports that will.
Makes sense.
Right. You have to have a COVID passport, basically.
Yep. Makes sense. It'll be part of your passport.
Right. Correct.
Question for Sue. Sue, for some reason, I get reports from Chicago, and Chicago had the teachers union was up in arms and put off going back to school for a good long time. Has our union made themselves known in any way?
So at Upper Moreland, our union has been very, very involved from day one. I can't even tell you the number of questions they asked and the detail of questions that they asked and requested before we went back. More than any I ever could have thought of. Now, I'm certainly not a teacher, but I was seeing the sick kids. They weren't seeing all the sick kids, I was, but I'm very diligent about protecting teachers and anyone in the teacher and the aides union. Very diligent about making sure they weren't going to catch it in school. They weren't going to bring it home to their families or their elderly parents. At the same time, they also espoused how they hated virtual school. Like, it was brutal for them. They were up at 5 a.m. to make sure their technology was working. They were creating lessons that everybody could do, and just the amount of individual instruction that's done nowadays. Jackson, my grandson's in first grade, and I'm here only occasionally with him when he's doing school at home, but he has these breakout sessions where the teacher works with only 5 students in reading because they're more advanced. And then she another day only works with 5 of the students because they're less advanced and they need different instruction in reading. So the amount of work for teachers to do this asynchronous, synchronous, virtual, let me tell you, the teachers that are in a classroom in school, they may have 8 kids in their classroom and the other 15 are at home. So they're teaching here and then they're teaching over here. It's just unbelievable. And the kids that are in the classroom are on their computer listening to the teacher up in the front of the room. It is so much work for the union. Upper Moreland did a fabulous job of addressing every single thing that they had a question about, including in my office. I don't know that I have any good heat, even though the high school's been redone. They brought me in 3 industrial air scrubbers, and they scrubbed my waiting room, a seclusion room in case I'm concerned someone does have COVID-like symptoms and is getting picked up within 30 minutes. And then they have an air scrubber in the area where kids are allowed to rest with a headache or cramps or stomach ache or whatever. So they've really, really worked hard to answer all those questions. I will tell you,
with the administration as well, rather than being a problem.
Yeah, no, they've worked very well together, very well together.
Good to hear.
Because the administration wants to satisfy the parents, and the parents are up in arms. They need their kids back in school. Their kids need school instruction. And you know, the teachers want to be back in school. Being at home is too much work, but they want to go back to school safely. I will say my daughter-in-law is in the Philadelphia School District, and they have repeatedly, they were supposed to start back, I think, a month ago or a couple weeks ago, 2 weeks ago, and the Philly school system has repeatedly put off because of the teachers union going back, because they don't feel that the buildings are safe. You think about Philadelphia schools and you already know that they've been in financial trouble, that their buildings are crumbling, they don't have appropriate air conditioning or heating. So the teachers want to make sure all those things are in place that they need for children, including having masks for kids if they come to school without them. And the teachers have also advocated for themselves, for those who are not always, you know, kind towards unions, advocated for themselves that their district needs to get them vaccinated. So they are now receiving their vaccinations, their initial one from CHOP. CHOP is making sure that the teachers in the Philadelphia school system are a part of their group that they're going to take responsibility for vaccinating. So it's a big improvement, a big help. But when I said earlier that disadvantaged children just bear the brunt of this, when you think about not having Wi-Fi, not having access to technology, not having laptops or Chromebooks or a tablet in their home, parents that can afford to stay home, quit their job or get a leave or work from home, the students in a city setting is definitely, they're bearing the brunt of a pandemic on their mental health, their emotional health, their academic success. The only good thing is the whole world is kind of in the same place. We're really all struggling with this. Is going to be a difficult year for students in terms of academics, except for maybe college kids. I think they're doing okay.
Well,
Thank you all.
okay, Carolyn, did you have a question? You're muted.
No, I didn't have a question. I'm good.
Okay. Any other questions or comments?
Yeah.
Did we help you?
Yes. Yes, you helped me. I have one more question.
Okay.
So if I don't get the shot in 2 years when I want to go to Puerto
Why?
Vallarta or whatever, I'm going to have trouble?
Possibly.
Ed's saying more than possibly.
Yeah, no.
I mean, again, I liken it to travel is going to become universal for, you're going to have certain documentation. You go to a third world country, you have to be, what, help me out, guys. I'm like brain dead, but you know, any of these other illnesses and diseases that we've sort of mastered, you have to document that you've had those vaccinations.
Like
in order to
malaria,
be allowed. Malaria, thank you. Yeah. We just, in going to St. Martin, everybody that goes there has to have a documented negative test, and they specify which tests they'll accept. Not all, okay? 120 hours before you step off the last leg of your trip. Well, they went, when we were down there, the cases in this island has about 32,000 people that live there. They had about 150 active cases. Now it's down to 30.
Wonderful.
So, and they were so meticulous about managing the COVID precautions, far better than we have done here. Just incredible. So I think that's going to be part of our life, our travel life moving forward. I really do. Good questions, everybody.
Yeah.
I hope this helped. Feel free to reach out to any of us, and also use you know, the CDC, there's phone websites. Kathy did a really excellent job on that step-by-step process for Pennsylvania and Montgomery County. I would make sure you print that or something so that you can use that as a checklist. Nicely done, Kathy.
Yeah,
Thank you.
thanks, Kathy.
That was really good.
Yeah, that's okay, but Lorelai put it together. I just sent her the
Well,
photos.
thank you, Lorelai.
Pictures. Well,
Yeah.
no, but if she hadn't have taken the 20 pictures, and frankly, that actually came about as a result of a conversation that Kathy and Diane and mother-in-law were able to be part of the registration process literally within the first couple of days in which the token system that has been enacted with the Montgomery County vaccination site, so that there's not line jumping. So every person gets an individual like security number, security token is what they're calling it. But they were literally of the first, you know, batch or two batches of people that were invited to use that process. And registered 2 of their family members 1 week and then 1 member of the family the following week. But in that first 2 hit a whole bunch of glitches. And we felt very, very grateful that after they hit those first couple of glitches, that literally the county turned around and worked to upgrade the software so that it very clearly said, hey, look, these browsers don't play very nice with, you know, our software. Like, please don't use these, use these. And also that, we're still trying to clarify specifically the insurance question, but we understand that you don't have to have insurance to get a vaccine through the county. However, they are asking for your information if you do have insurance, because while the shot is free and has been provided free by the federal government to locales, that does not cover any of the cost of administration. So any of the nurses that are helping to administer them, any of the background people that are helping to, you know, meticulously like process that data and all that sort of thing, there's a cost to that, and without, you know, some sort of payment related to that, you know, hospital systems, county governments will bear the brunt of that cost. So we've also been told that, you know, you really can also, the rollout of this hotline has actually just happened this past week. And the rollout started first for the answering of questions, but now also to assist with registration for those that have not yet registered. So there is a way for seniors, but for really all individuals that are categorized as part of 1A currently. So 1A is 65 and above, and those that are 16 to 64 with particular conditions, you know, compromising conditions, that you can register also through that hotline right now. So we're really grateful for that. And we were also told that that if you were to register by phone, you know, another big thing we've heard about here in Montgomery County is that there's this like really long line of like 170,000 people waiting to get the vaccine. What they have said is that they will be trying to prioritize those people who will be registering over the phone, seniors in particular who've registered over the phone, and holding open actually a percentage of the vaccine and the vaccine administration so that you're not fully at the back of the line of those 172,000 people, right? So I think trying to acknowledge that we have had vulnerable populations that just because of not having access to technology, you know, they were later in getting the phone system open, but it is open now. So I think that's some really good information that those of us that can pass that on and share it with our neighbors would be really welcome.
Yeah.
Final passing thought. If you do have a committed appointment and for whatever the reason you cannot attend to get your vaccination, please notify that site or that facility, because your dose has been calculated and this stuff is so precious. You don't want to risk any of it expiring and not being able to get into people's arms. So just be courteous and, you know, just try to get there. It's really important.
Along those same lines, I was actually talking to one of our members too, who had registered through multiple sites, and the county has in fact encouraged that. In fact, 2 out of 3 shots being administered in Montgomery County is happening outside of the county's administration. So 1 and 3 is happening by the county sites, and 2 out of the 3 are either through hospital systems or pharmacies.
Pharmacies.
Having said that, if you're registered in multiple sites, at least related to the county one, they have provided that website that I shared again in the email that came. And they did say, please, if you would let us know that you don't need a slot anymore, that gives us an opportunity to kind of keep working further down our list. So, you know, kind of being responsible in as much as asking to be removed from lists when you've received a notification that it's your turn really helps continue to get that administration to people that are waiting and sometimes not so patiently. Thanks, everybody. Okay.
Just one more comment. They also said that on that call on Friday that they're working through people that had signed up on the 13th of January. Now that was a huge number of people, like 30,000, and they hope that they might be able to get to people that signed up the 14th of January sometime this week even.
Okay.
So
That's
just
progress.
watch your email. Yeah, watch your email. And it seems like the invitations are pretty much coming through on Monday nights.
Okay.
So
Monday's the day. So
it's
tomorrow's it.
happening. It's getting better.
Well, just stay safe, everybody. And it's really good seeing you.
Yeah, good to see everybody.
We're going to get this.
Yep.
It's going to be okay.
It will be.
Take care.
Take care, everybody. Thank you so
Bye-bye.
much. Goodbye.
Thank you. Bye.
Bye.